Good day. Today, I will demonstrate to you how to do endotracheal intubation. I have here an obese COPD patient who just recently self-extubated. The following are his vital signs. Before examining the patient, wash your hands and wear proper attire and put on mask and gloves. In examining the patient, look externally and observe for any abnormalities and lesions. Also check for 3-3-2 rule. 3 finger breadths from the lower to the upper incisors. 3 finger breadths from the hyoid to the lower border of the chin. And 2 finger breadths from the thyroid notch to the base of the tongue. In positioning, since the patient is obese, study shows that ramping or putting pillows under his head, aligning his ear to the sternum, can make intubation or viewing the vocal cords easier. In addition, check for neck mobility and other important measurements such as thyromental and thyrosternal distance, as well as the Malampati score of the patient. For the materials needed, monitors such as cardiac monitors and pulse oximetry, airway, including your endotracheal tubes, stylet, laryngoscope, your bag valve mask, stethoscope, plaster, and syringe. Don't also forget your IV fluids. And for the drugs, and since this patient has a blood pressure of 80/40, muscle relaxant is the only needed drug for him, such as succinylcholine. And this is my model specimen. Before starting intubation, make sure to pre-oxygenate the patient first. Once the head is optimally positioned, tilt head into extension to bring all axes into alignment and anchor it by using your left hand. In opening the mouth, use your right hand and make sure that you place your finger as far to the right side of the mouth for the easy insertion of laryngoscope. Hold the handle using your left hand, blade down and pointing away from you. Insert the blade slightly to the right side of the tongue without hitting the teeth of the patient. Slowly advance blade until you see the tip of the epiglottis and sweep the tongue to the left as you advance. Once the epiglottis is seen, transfer weight of the head onto the blade as you lift it. Once the larynx is seen, you can now pass the endotracheal tube into the larynx through the cords in one smooth motion. Pass the tube to the right of the blade on the right side of the tongue. Stop advancing the tube when the cuff completely passes the cords, which is usually 21 to 22 centimeters to the front teeth. Hold the tube in the right side of the mouth and remove the blade with your hand. Remove also the stylet before you fully advance the tube down the trachea. You then inflate the cuff by slowly injecting air through the pilot tube until the balloon just starts to get tense. You can then secure the tube, putting plaster on both sides of the tube. Lastly, verify the placement of the tube by auscultating the breath sounds of the patient. Both lungs should have equal breath sounds. Thank you for watching.